Okay, have you seen the movie What to Expect When You're Expecting? It follows the ups and downs of pregnancy through the experiences of several different women. And at the end, it portrays the many, many ways birth can play out, from a C-section to an unmedicated birth. However, every single one of these mothers is lying on her back, and it makes me want to rip my hair out. Coming from a mother who has given birth on her back in a hospital and on all fours at home, I can tell you that lying on your back with hospital staff yelling at you to push this way, push that way, is the worst way you could possibly meet your baby. It increases pain, it causes tearing, it takes hours longer, and I want to spare you the pain, so stick around, because by the end of this video, you're gonna know the 6 most common pitfalls made during pushing, how you can avoid them and have a better natural birth experience. Hello, my name is Maria. I'm a Lamaze-Certified childbirth educator and owner of the app Natural Birth by Echo, a free app with all the tips and tricks you need to make your unmedicated birth a positive one. Okay, the first and most obvious mistake, or at least it will be the most obvious, when it comes to pushing is lying on your back. Like I just said, this is a terrible way to push. Why? Because it closes your pelvis by up to 30%. There is a small little bone on the pelvis called the ischial spine located on your lower back. During childbirth, the ischial spine is designed to shift out of the way, just like moving your finger. It goes back and creates room for your baby. When you're lying on your back, the ischial spine remains locked in place and your baby is stuck. This is why pushing on your back takes an average of 3 hours longer than any other position. It results in more vaginal tearing, more emergencies. The baby goes into distress. We're just not designed to give birth on our backs. Now, I will say some hospitals still require that mothers labor on their backs so that the doctor can see better, they can take better notes, and frankly, it helps keep them out of a lawsuit. But that's not your concern. Your priority is having a positive, safe, and empowering birth experience. So make sure that you vet your birth attendants carefully to ensure that they are fully on board with your birth plan and prepared to support you in pushing in whatever position feels right to you. Okay, the next big mistake is coached breathing. This is also something you see a lot in movies and in hospitals. The provider will tell mom, hold your breath, count to 10 and push. This is called the Valsalva maneuver, and while it does exert a ton of force when pushing, it also results in severe vaginal tearing and lowered oxygen for both mother and baby. Obviously, this is scary. Less oxygen will be exhausting for you. It will increase your perception of pain, and it will expose your baby to danger, making them more likely to go into distress and require a C-section. So include no coached breathing on your birth plan, and breathe however you want. You honestly might hold your breath instinctively. I did a little bit during my home birth, but that's likely not going to be for more than a few seconds. And as long as you're doing what feels right and normal to you, you and your baby will be just fine. Okay, pushing mistake number 3 is coached pushing. I remember the first and only time I gave birth at a hospital, my obstetrician was not familiar with unmedicated birth. So as I was pushing, she would give me instructions. She would say, push, now stop pushing. No, I said stop pushing. And meanwhile, I'm following my body's pushing instincts, which of course has a timeline of its own. So her little voice in my ear telling me to ignore my urges to push or push when I didn't feel the urge, it was ultimately distracting and unhelpful. So if you're planning an unmedicated birth, you're gonna wanna tune into your body. So make sure that you specifically say no coached pushing on your birth plan. Make it clear that you will be following your own internal cues. Okay, mistake number 4 is pushing just because you're at 10 centimeters. You might be 10 centimeters dilated, but it doesn't necessarily mean you have to start pushing right now. Remember that the urge to push is caused by station, not dilation, meaning once the baby is far enough down the birth canal, the pushing instinct will be activated and your body takes the guesswork out of it. However, if you start pushing before your body's ready, you're going to exhaust yourself trying to get your body to do something it's not ready to do. So push when you feel the urge to do so. Your instincts know what's best, and they want to make this a simple process for you. Speaking of instincts, some providers will tell you to ignore them, which leads me into mistake number 5, ignoring the urge to push. you might want to push early. It's common, it happens. You might be 7 or 8 centimeters dilated when you feel the need to push. Do you just ignore it because you're not dilated enough? No. When you get an early urge to push, it's usually because the baby is not in the best position for delivery. Your body knows this, so it gets you to push a little bit to help the baby shift into a better position. Pause for a second. Is that not the coolest thing? Let's just pause and acknowledge how brilliant your womanly body is. It's doing all this work behind the scenes, and all you have to do is breathe, relax, and trust your instincts. Now, that being said, some people will tell you that pushing before 10 centimeters will damage your cervix. It will cause swelling. It will end the world. I don't know. It's not true. If someone tells you this, ask them to show you the evidence. There is none. There is absolutely no evidence showing that you have to wait until you are exactly 10 centimeters dilated. What about women like me? I did not get a single cervical dilation check when I had Colby. I did not need one because my instincts told me what to do. So while there is no evidence showing that you have to ignore the urge to push before 10 centimeters, there is data proving that ignoring this urge at whatever stage is dangerous to the mother. It leads to postpartum hemorrhage, bacterial infections, and longer labor times. So please don't have any qualms about just listening to your body's cues and doing what feels right. Okay, the final mistake that occurs when pushing is not slowing down when crowning. When I was pushing with Colby, right here in this very room actually, I failed to take my own advice and I was pushing, going really fast, really hard, and my midwife whispered, "Maria, breathe, slow down, there's no rush." She saw that I was going too fast because I just wanted it over with, and I was giving myself internal tearing. And side note, this is why I am a huge advocate of hiring a doula, because you can know all the information. I am literally a natural birth educator. I know you should slow down, but when you're in the thick of it and all of your knowledge goes out the window, it really helps to have someone there with you who is familiar with the true physiological birthing process. Anyways, back to pushing. My midwife knew that the vaginal tissue is designed to stretch gently for your baby. It's kind of like pulling your head through a t-shirt. It's a gentle stretch. But when you push too quickly, your skin will not have time to loosen and it will then tear. So when you start crowning, slow everything down. I know you just want to get your baby out at this point, but in this moment, breathe, relax, and take it one contraction at a time. Okay, that wraps up my top 6 mistakes made during pushing. I hope you found this video helpful. If you did, hit subscribe because you are in the right place to prepare for a positive, natural birth experience.